And welcome. Hi, everyone. My name is TJ. Welcome to today's training from Heads Up Health. This training is called Ditch the Spreadsheets, how to centralize your clients' health data all in one place and optimize their outcomes with ease. So first off, who is Heads Up? Who are we? Who is Heads Up Health? It's Heads Up for short. We're headsuphealth.com. And ultimately, we are a health analytics for high performance and optimal wellness platform. Health data analytics is the name of our game, and we are here to help practitioners learn what is driving their patients' health. So today we're going to talk to you about and learn from you about your process of using spreadsheets and how you can avoid the challenges that come with that, and ultimately centralize all of your clients' data in one place to make it easier to optimize outcomes, save time, and run a more efficient and effective practice. Ultimately, we want you guys to be successful. Everyone's moving to virtual these days, but it's not easy. Data is everywhere, and keeping your clients engaged, there's lots of challenges. So quick background on us. This is a background on our team. So myself, TJ, I've got a deep background in behavior change science, in the health coaching industry and the self-coaching space. So I've done a lot of coaching myself for executives. I am an author. I wrote a book called The Art of Health Hacking, which is a self-coaching guide that democratizes the art and science of behavior change to the average person, giving them behavior change formulas to be more activated in their own health. And then I also host my own podcast. And that podcast is where I interviewed our founder and CEO. So the founder and CEO of Heads Up is David Korsunski over on the right. He's got 15 years of experience in the data analytics and technology space. And he got very interested in quantifying his own health, just like I did early on, and built this platform from scratch all the way back from 2016. And then our chief medical officer, Dr. John Lemansky, runs a very successful virtual practice, a virtual preventative telemedicine practice. And he may be joining us today as well. I think, yeah, John is on right here. So John, I'll go ahead and promote you to a panelist so you can introduce yourself and welcome everyone to the call. It looks like Donise is on as well. So we got a lot more people hopping on. John, are you there? We'll let John make his way on. There he is. He's probably just in the middle of seeing patients. Hey, John. Is the audio a little delayed? That's okay. For some reason, I'm having trouble hearing you.
How about there?
Yeah, now we're good.
Okay. Yeah, sorry, I was on the, I was trying to load Zoom and it made me update to a new version and then it wouldn't work.
Technology.
Awesome.
Yeah, so if you want to give a brief background of yourself and your involvement with the organization, and for short, that'd be great.
Yeah, sure. So thanks for that introduction. So yeah, I'm the chief medical officer for Heads Up Health, and I've been practicing medicine for about 10 years. So I'm an internal medicine doctor, and I trained traditionally, worked in a hospital for quite a few years, and really started hacking my own health because I was having some health issues. And as a physician, I felt like I should know what I was doing and following the guidelines, and still was tired. I was never obese, but I had metabolic syndrome basically. So started hacking myself, and about 7 years ago, people started noticing a difference and asking me for help. And so I transitioned over to a kind of preventative longevity medicine type of practice and built it over 3-4 years. The major issue that I had, though, was because of all the technology that we're using, the data that I was getting, the labs that I was getting from so many different, either LabCorp or Quest or other kind of alternative lab, it was tiresome. And it was actually a lot of my day was spent data entry into, like TJ mentioned, spreadsheets. I always hated Excel, and all of a sudden now I was trying to be like, a wizard at Excel. So I actually met Dave at a conference. So I met him at a conference 4 years ago, and he was actually presenting. I was presenting, and when he presented his company, it was life changing for me. So I immediately struck up a conversation with him. And anybody who spoke with Dave, he's very personable, very passionate about the product, and was telling me not only where it was, but where he wanted to go. So I initially signed on just as a user, and then we started seeing each other at different conferences, and really realized that we had same goals, and we're just attacking it from different perspectives. So he was looking at the data, I was looking at the health, and we figured we should do a partnership so that we could build something that would work not only from a consumer perspective, but also the practitioner perspective.
Definitely.
And, over time, and now with TJ really integrated in our team, we're talking about not only how to make the product great now, but going forward, what are we going to be able to do? How are we going to make this product so that it's going to be more functional, user-friendly for both practitioners and clientele, and especially now going forward where telemedicine, telehealth is going to be, I think, one of the predominant ways of practicing, since there's going to be social distancing for some time to come. And so for me, in my own practice, I've actually transitioned quite a bit over to telemedicine and practicing mostly online. And so it's been a real advantage to have this. And I know TJ is going to go through a few of the parameters and the way that the system works, where it simplifies, it really kind of streamlines my day in terms of looking at data, accessing the data. And so it's been really, really beneficial.
That's great. I appreciate you sharing, John, and appreciate you being here with us, being a part of our team in this movement. And it's funny how synergies come together with you and Dave connecting, and I love that you're still involved, and we're where we are now. So, and yes, as we said in the emails, like you said, John, you're using this platform actively, and it's helped you go from spreadsheet hell to data analytics heaven, and that's kind of our intention for everyone today. So I'll go ahead and dive in and give a quick background on the company even more. So why were we founded? Ultimately, general problem of an outdated healthcare system. So conventional medicine doesn't meet the needs of an increasingly large percentage of the population. Our platform, we work with individuals on our platform, anywhere from chronic illness all the way to professional athlete high performers, and everywhere in between, right? So that whole proactive, healthy, cash pay wellness economy. And so we can make it as simple or as complex as possible. So chronic disease all the way to pro athletes. And as John was talking about, how the data is everywhere, what we found and what we wanted to solve for is this very problem. And that is how fragmented the health data really is in our world. So this slide gives you an example of how fragmented it really is, right? These 5 categories of companies. So device companies, testing companies, operating systems, patient portals, you name it. The data is very fragmented. Your clients might send you their Oura Ring data or their genetic tests or the blood tests. They've got their patient portals. You've got your EMR. Data is everywhere. It's very fragmented. And it frankly slows down and makes practices less efficient, which ultimately leads to not as good as quality outcomes. So our intention from day one has been to integrate as much essential health data into one platform so you can centralize all of your clients' health data in one place. So that's step one, is to centralize all of the data in one place. And then from there, what we've done, because we're so passionate about not just the individual client having full ownership of their health data, but them making sense of the data, and their practitioner now with our health professional portal, the remote patient monitoring, which we'll get into in a second, But we then add analytics tools for you to make meaning of the data, to help influence, like, okay, why did my CRP go up these last 3 months for my clients? Why is their sleep going down? And correlating all of this data together to see how lifestyle behavior change, how your protocols influence objective data. So, and so we're all about personalized, N equals 1, health, better health outcomes. So that's our intention. So we started direct to consumer. So a quick background on us. We started direct to consumer, integrating both medical data with lifestyle data. So clinical labs and lifestyle data from like apps, devices, like the Oura Ring, and many others. So it's all centralized data. And then the analytics tools helps the individual and now the practitioner to make sense of that data. So we have over 30,000 members in 60 plus countries. We've been around for 4 years. And now we're here to help the health professional ditch those spreadsheets and really take their health data analytics to the next level in their practice. So our health professional solution now gives coaches, doctors, and other patient-facing health professionals unprecedented access to their clients' data, real-time data too. So like a remote monitoring platform. In our world of COVID-19, as John mentioned, the social distancing we have going on now, we've become very, very busy trying to fulfill all of the coaches and doctors coming to us saying, hey, I need a solution to get my practice more virtual. I need a solution to monitor my clients' data. I'm tired of living in spreadsheets. I need this all in one place. And so that's what we've built. So I'll give you a kind of a quick little background and a demo of some of our core features, but I'd love to just pause right now for a second. For those of you that are on this call with us, I would love to hear, how are you, if you haven't already introduced yourself, I know a few people already have, go ahead and introduce yourself in the chat box. Tell us your name and your practice, so the focus of your practice. What sort of coaching or medicine are you providing your clients? And why were you interested in hopping on this webinar? Tell me a little bit more about where your practice is at. Are you actively using spreadsheets? Are you wanting to get out of spreadsheets? Go ahead and introduce yourself and answer a few of those questions in the chat box. This can be really engaging. We want this to be dynamic on today's call. So you can use the Q&A or section or the chat box. It's up to you. So I'll look for a few of those more introductions coming in here and some background. Basically, I just wanted to confirm, you know, do you also run a virtual practice? Like, is that a part of your practice as well? So tell us in the comments, like, are you mostly in person? Are you mostly online, or a blend between the two? That will help us be able to frame and give you guys proper context and guidance for the application of our top tips for using and getting out of spreadsheet hell. So I'll look for those introductions coming in the chat box, but ultimately our goal for you as practitioners is to validate your clients, validate your programs and protocols that you give to your clients. So, and we cut out the guessing. The data doesn't lie when you analyze it properly. And you're on the same page with your clients. So validating programs and protocols is ultimately like our big goal for you as practitioners with the data. So I'll give you a quick little demo of the platform in a second, but just to let you know, we launched the Health Professional Platform in January of this year. And the opportunity to get involved with us is a really cool community that we've been building called the Founders Club. So the Founders Club inside of Heads Up is the first 100 health professionals from all over the world. I know John's in Puerto Rico. We've got clients in Australia, Denmark, the UK, India. They're everywhere. And for the first 100 data-driven health professionals, we're really intentional about who we bring on and work with. So we're really curating this community, and it's for the first 100 data-driven health professionals. So those coaches and doctors, if you're one of them that values data-driven outcomes, then we can talk about potentially joining the Founders Club. So if you're interested, we can share more about that towards the end of today's call. And we'll also give you some top tips for how to use our platform to actually get more leads. Who wants more leads in their practice? Who wants more clients? Raise your hand, metaphorically speaking, if you're watching this right now. So that's, if you stay on to the end of today's webinar, we will share those top tips for you. So, but the Founders Club is a really cool community. Dr. Lemansky and I lead a monthly webinar. The fourth Wednesday of each month, we have a private Facebook group. You get a customized dashboard and early preferred pricing. So cool. I see Denise introduce herself. You're an MD, so I think a naturopathic medical doctor, perhaps. You're a practicing physician, researcher, and educator, and you're looking for solutions to integrate your EMR and specialty testing data. You already do a lot of virtual health, and you're interested in data-driven outcomes and the Founders Club. Awesome. Thanks, Denise. Appreciate the share and the background on your practice. That's great to hear where you're at, and you're already doing a lot virtual, and you're interested in our Founders Club. That's awesome. Cool. So let me go ahead and I know a few people will put their updates or intros in the chat box as well. So keep on doing that if you're writing that up. The first thing I want to kind of share with you on here is really asking, what is your current process for tracking your clients' data? And I'll show you what it looks like for our user experience, for our help, for our individual, for the clients that use our platform. So for those health professionals that invite our clients, their clients to join our platform, or our individual users. Like I said, we have 30,000 individual users using our health data analytics platform, almost like an electronic health record for the individual. Okay, so this is a screenshot. This is actually a live viewing inside of my own personal dashboard. So this is my data, no judgment, and I'm signing the PHI waiver right here. This gives you a taste of what it's like to get all the health data in one place. So we call this the dashboard. This is the lifestyle dashboard. This is 100% customizable, meaning your clients can move tiles around really easy. You can drag and drop. You can add new tiles that aren't there. In addition, all of our Founders Club members actually have the chance to customize and choose what data points they want their clients to track on this dashboard. So it keeps them focused, so they don't get overwhelmed. As you can see, there's lots of options here, which I'll go through them. So data can be entered in manually or through connected devices. Manually or through connected devices. For instance, we pull in data from lots of wearables and devices, which I'll show you in a second. But we can also have data entered in manually. So blood pressure can come in manual or through a connected device. Same with body temperature. Same with blood oxygen. And I'm pulling that in from one of our wearable partners, which is BioStrap. AM readiness score, which with a wearable called the Aura Ring, which I'm actually wearing right now, and John might be as well, and maybe a lot of you are too. Caffeine intake can be tracked manually. Sleep time. What's cool about these tiles is if you have your clients tracking this data, they can click into each tile, and as can you, and you can see a snapshot of their data from the past 7 days. So it's really cool. So my AM readiness score from the Aura Ring, I can see the last 7 days worth of data just clicking that. So we've got weight, blood glucose, movement, meditation time can be tracked. Alcohol intake can be tracked, of course, manually. Resting heart rate can come in from wearables. Heart rate variability, which is a topic we just talked about on our last monthly mastermind, which we brought in a chief science officer from BioStrap, one of our wearable partners, that talked all things heart rate variability, which is a key metric. It sounded like Marek, you're a nutritional therapist. You mentioned you're using that in your practice. So we've got that past webinar if you want to watch that. It's in our private Facebook group. We have a behavior change modification tile called Quit Events. This allows your clients to track via a timer what habits they want to take a break from, what they want to cycle off of or or quit. So alcohol, sugar, smoking, or other, and you just create a timer, and that'll track that change of behavior. We also have a fasting timer, and mine got a little longer than I had thought. I was not doing an hour and 22 hours fast, so I'll go ahead and save that one. But this fasting timer is cool to correlate. Basically, all of this data individually has value, but where it has a lot more value is when you bring it all in together, which I'll show you in a second. Blood glucose, ketone data from urine, breath, or blood, carb tolerance testing to track before and after blood glucose readings, and also chart your subjective symptoms. Measurements from any body part, body fat, macronutrient data. And we're also doing some advanced tiles that we recently added. Cryotherapy is one right here. Cryotherapy, we're coming out with hyperbaric oxygen. We're coming out with photobiomodulation, so red light therapy and sauna. And cold plunge, I think, is another one that's coming out too. So this is our lifestyle dashboard, 100% customizable. Now, let me go ahead and show you how you connect data. So to connect data, it's really simple. Again, this is what the individual has access to, as do you, but they can connect data on their own. They just come up here, select devices and apps. You go to group 1. These are all the mainstream data sources. So we've got Withings, Apple Health, Fitbit, Garmin, MyFitnessPal, as well as Google Fit. So the way it works, the individual logs in once to each of these platforms. We'll create a magic connection, and we'll automatically pull in that data securely straight into the platform. So that is devices and apps group 1, and devices and apps group 2 that we integrate with are Aura Ring, as I mentioned right here, the BioStrap, which is a similar data that the Aura Ring does, so sleep, movement, and recovery data, but it's worn on the wrist. Keto Mojo, they were our original integration partner, blood glucose and ketone monitoring. Their Bluetooth version, we pull that data straight into our platform. We have an exclusive integration. They're one of our early integration partners. BioSense, which is a breath ketone acetone meter we just launched with. Macronutrient, we pull in chronometer and my macros. And Elite HRV for heart rate variability. So we have more integrations than any other platform for both lifestyle and clinical data. This is the overview of the lifestyle data and how it works. It's really simple. If you're running a concierge practice, you can get your clients login details and connect them for you, or they can do them themselves. So any questions on any of this? Yes, we are HIPAA compliant. So good question, Denise. So we are built on Amazon AWS. So super secure encrypted data. And we're always going above and beyond to keep the data secure. So good question there, Denise. So that's an overview of the lifestyle dashboard. Again, the individual has access to, this is also available on a mobile app. So right now, if you're sitting at your computer or maybe you're on your phone, you can actually go and download the app yourself. It's Heads Up Health. Search for the app in either of the app stores. And you can download it and your clients can use that as well. So that is the lifestyle dashboard. Again, if you have any questions, feel free to put them in the chat box. And I imagine that a lot of you might have experience tracking some of this data, but how much of it is centralized? That's the question that we have for you. How much of it is centralized? As we said in the first few slides here, the biggest problem in our country right now when it comes to health data is how fragmented it is. It's really hard to make meaning of data when it's all in several different areas. Spreadsheets, emails, EMRs, Google Drives, you name it. So this is kind of our main start. This is our dashboard where everything is handled. Again, this is all customizable. So the next thing to highlight, and I'd love to hear from you as well, John, what you like best about this, like what data you like to track for your clients in the lifestyle dashboard, but also our lab results section. So the lab results section is where we can house and organize all of your clients' lab testing data. And we've got 3 different ways to add data. It can be entered in manually by clicking this Add Biomarkers button. It's really simple. A box pops up and you put in the actual data points and the values that you want in for each. We have a concierge service, transcription service that can do it for you, which is a nominal charge. We charge in 15-minute increments. And our third way to do it is if you were in the States and some in Canada and beyond, we have some automatic integrations. So to show you how, and this is again where we are above and beyond where any other platform is at, are medical records integrations. So to integrate medical records, blood testing data, you come up here to connect data, you go to medical records, you can search by your doctor, you can search by your lab. So we have automatic integrations with Quest Diagnostics and LabCorp. Raise your hands if you've heard either of those. Those are some of the mainstream ones, of course, that we integrate with. And we can pull in all historical data. The client can bring in all data that they have through either of those lab testing portals or by their hospital or clinic. This is where it gets really valuable. Again, as I mentioned earlier, we're all about like the individual taking ownership of their health data. And what our platform does is it allows them to bring in all of their data into one place, including all of their historical data. So they can search by their own patient portal right here. So let's say they wanted to pull in Cleveland data from the Cleveland Clinic or really any different platform. So you can see here any different patient portal. I encourage you to get a free trial, and I'll send you a link and we'll go over how you can get a free trial and start to play around with their platform soon. But I encourage you to search by different popular patient portals and health systems that you or your clients work with, because they can pull in all of their historical health data into this patient portal. And we support them with the rise of what we call a smart patient. So we're all about creating smart patients. And a lot of times they'll end up having more data on themselves than their own doctor will even have. So that is an overview of how you connect data. We also have pharmacy integrations. I'd love to hear from John right now. How do you use the lab results section? How do you use the dashboard? Tell us in your practice, like what's most valuable to you about, how these help you get out of spreadsheets and digitize it in one place.
Yeah, definitely. I think the last point that you just brought up about being able to access patient data and pulling it into the Heads Up Health platform is probably the biggest time saver you'll ever have, because a lot of people have data from multiple different facilities by the time they get to me. And so trying to kind of go through PDF files and trying to input that data is, it's a waste of time, both on the practitioner's end and the patient's end. And so you lose so much valuable information, I think, that way. So by pulling that into our platform, you can, and you haven't shown this, but you can definitely show, trends in the data. So looking back, years, showing outliers to make sure that, the data that you're getting is as accurate as possible. And then really going forward by whatever implementations that you're doing in your practice to show the main difference. So for me, a lot of patients I work with are high functioning, like CEOs, entrepreneurs, who have basically put their health aside in order to become successful in business. And so now they're kind of looking back. They have resources, but they're not healthy. They don't want to be put on medications. Their goal is to get off of medications. And using this data specifically is important to really be able to show, look, the implementation of certain protocols is really allowing you to become more healthy, and this is how we're going to track it. So it's not only the historical data, but going forward, being able to access not only the kind of basic labs that most people come in with, but then some more specialized labs that we can.
That's a great point, actually. Yeah, I'm gonna get to the analyzer to track trends in a second, but yep. Regarding the advanced labs, so I know Marek mentioned and maybe Denise did as well in the chat that they're doing some more specialty advanced labs. So let me show you how we've got templates to have these added in manually. So we don't have automatic integrations with every advanced lab testing company yet, but to show you right here, the way it works, it's pretty simple. So we have templates built out for you to enter in data for Genova Diagnostics, DEXA, if you're doing full body DEXA scans, Quicksilver, Great Plains, SpectraCell, Doctor's Data, Vibrant Wellness, Prodrome, Dutch Test, Nutrition Genome, and ZRT. So this gives you an idea of like, you know, we're not just saying we're data driven, like we're also, like a lot of our members, our Health Pro members, are integrative, are functional, are naturopathic, and are all focused on root cause health optimization. And so we're built and believers in the power of these advanced blood tests. And maybe down the road we'll have automatic integrations for them, but at least for now we have the templates for you to actually add in data from your client's tests that we don't have integrations from. Good point. Glad you brought that up, John. And yeah, I mean, the feature, just to show real quick, to highlight, is how easy you can compare and contrast. So it's not in a spreadsheet, it's super secure, and it's all side by side. And then as the next feature we're going to get to next is the reports feature, all about doing deeper analysis of the data. John, I interrupted you. Is there something else you wanted to add?
Well, just as far as the dashboard, you know, if you can go back to that section. And I think
the lifestyle dashboard?
Yes, please.
Okay.
Yeah. The great thing about this is, you know, not every patient is going to be the same, but for the most part, a lot of the core metrics that I measure are going to be similar for individuals, because the goal is usually relatively the same. But the ability to really not have a static dashboard, you can customize it. A lot of clients like to customize it themselves as well, because they may want to focus on something at a particular time. And so a lot of what I do will go in phases. And so, you know, hitting somebody up front with all the lifestyle changes, the hacks, the nutritional changes is a little bit overwhelming. And so a lot of times what I'll do initially is simplify the dashboard to just maybe 6 or 8 metrics and have them focus on those. So the point though is that it's very pliable. So you can either make it so that there's as many tiles as you want and track, you know, excessive data like caffeine intake, which is awesome. My number, I would never show you my number because I'm currently, it's 2 o'clock and I'm still on decaf.
140 is an anomaly for me, by the way, right here. That was, I put it in to see how it affected.
It's pretty awesome.
Yeah.
Yeah, but the point is that you can, I mean, track so much data, and some people like to have more data. I'm definitely a data-driven person.
Right.
But you can also simplify it where it's, you know, start off slow, show, you know, the main kind of metrics that you're looking at, and then build into it.
Totally.
So it allows you to be very pliable in your approach, which I think is awesome.
And that's actually, so why I brought up this spreadsheet here. So heads up, we do use some spreadsheets at this point for onboarding, but eventually this will be all self-service. And part of our onboarding process for those docs or coaches that decide to move forward with us and roll this out in their practice, we will customize. You'll get one default dashboard with only the data you want your clients to track. So it'll be default across the board for all your clients, and you'll fill this spreadsheet out. As you see, we have over 60 different data points that you can put on the lifestyle dashboard. Maybe you just start with 5. Maybe you just start with 10 or 15. It's up to you. Depends on your practice, depends on your client, and that's actually part of the onboarding process. We can work with you, set up a one-on-one call to go over like, okay, what's your practice like? What's most important to track? And then actually build this for you inside of your Founders Club membership. So glad you brought that up. That's how that works for onboarding and customizing. Great point. So the last, so next I'll show our medical records. So we have a HIPAA compliant Dropbox of health files. If you want to store unstructured data, PDFs, JPEGs, etc., you can do that here for your clients. They can also upload, and you can create custom folders. Really start to use this as a Dropbox of health files, a Google Drive of health files. It's really easy to add, and we'll eventually be building, one of our newer features that we're working on is creating notes and protocols. So soon, we're going to have the ability to roll out notes and protocol development for our health professionals to use and deliver to their clients. So that's a pretty exciting feature that is on our roadmap in the short term that will allow you to really create files from scratch. So that's pretty cool. Last but not least is our reports section.
Hey,
So,
TJ, can I just
yes.
jump in for 1 second on that last point? So I've used pretty much every electronic medical record system out there. And so I'm really kind of driving the point home with the team that the kind of electronic medical records, the ability to write SOAP directly into the system will really, again, simplify your daily practice. So you don't have to have a separate software. It's already integrated. We're going to try to be able to pull data into it without making it so complicated, which a lot of medical record systems are, so that it's very simple. It doesn't take more time to learn it. You don't have to go through a training session, but it'll be very, very simplified. But again, a lot of the things that I think most of the healthcare practitioners understand is that a lot of what we do is repetitive. And so having kind of templates already built out will be also part of the goal. So that, if you're seeing somebody, if your specialty is GI issues, and you're really working on gut microbiome, you don't not necessarily have to write the same thing from scratch every time. You'll be able to kind of have a preset template to use. So again, another way to really simplify the process. And that I think is going to be super helpful, and that should hopefully be developed, relatively soon.
Totally. Yep. I'm glad you mentioned that, just to kind of give you guys a taste and a screenshot of what that looks like. This is a screenshot of what the notes feature will look like. So I know some people are just joining us. Hi, Angela. Go ahead and introduce yourself in the chat box and your interest in today's training and webinar. So this is a screenshot of what it's going to look like. I don't know if you've seen this yet, John. So it's going to be a document section that will allow for just individual notes or protocol development. And really simple, you just click create template. You can create a new note, and we'll have a text box here. You can mark it visible to the client or not, and add in different sections. So that is the note template. And then creating a new protocol will look like this. So the name of the protocol, the focus, and then you can have different sections of the protocol. So food, lifestyle, supplement recommendations, etc. So these are some screenshots of the design that we have coming down the pipeline for our newer features of our Heads Up Health Pro portal. So last but not least in the demo is the report section. This is where we help our individual users and coaches and doctors make meaning of the data. So we formerly called the analyzer. This is now called reports. You can pull in up to 6 different data points that you are tracking inside of our system. It can come from the lifestyle dashboard or the lab results section. And this is where you can start to analyze it and make meaning. You can customize the time period that you're looking at. So right now I have 4 weeks selected. And what we automatically do, whatever time period you select, we will compare that to the prior time period. So this data right here, all this data in this graph is my data from the last 4 weeks, but down below, we show you where you're trending relative to the prior 4 weeks. So how my heart rate variabilities from nocturnal, sleep, HRV, overall marker of recovery. The last 4 weeks, I'm trending up 11%. So my recovery is doing well. Could there have been a lifestyle behavior change that impacted that? My deep sleep is also trending up by about 10%. Could there be a correlation between HRV sleep and deep sleep both being high? And my total time to sleep is pretty flat. But I've also got alcohol intake on here, and you can start to plot and see how these behaviors are impacting sleep. I actually have a whole blog post all about how alcohol impacts sleep. So anyways, you can customize the time period. We'll show you where your clients are trending. And then from there, you can export the data as a PDF, a CSV, or a PNG to show you what that looks like. So Denise asked, will we have a section for SOAP notes? I think we already covered that. Yes, that is the feature that we just showed you there. So here's the analyzer report. We'll put the data that you're tracking, the time period you're analyzing for. We'll give you the graph, and we'll give you the trending data below that. And then we'll give you all of the raw data on your clients in case you want to review it and analyze it further. So this is a pretty exciting feature. All of our coaches and doctors love using this with their clients. Their clients can run their own reports. You can run reports on live Zoom calls like this or in person. You can do it for them. It's a pretty powerful report feature that we've just recently launched and allows you and your clients to further make meaning of the data. So, but where this becomes really powerful is validating your programs and protocols. So let's say you've been working with someone for 3 months and you want to see how they're doing these last few months compared to the first month. You can customize that time period. You can pull in not just data from the Oura Ring, but also data points like CRP and A1C and blood glucose and cholesterol and whatever clinical marker you're tracking in your lab results section. You can correlate that to lifestyle markers. And that is where this is gold for you as a practitioner, as a coach with your clients. And it'll keep them motivated. Data can really have an intrinsic accountability to it because it gives a logical guidance that they're making progress in their health. And that's what this is all about. We're here to bridge sustainable health, behavior change, and better outcomes, and using data to help you get there. So any questions on the analyzer feature? Again, I know this is just a quick overview. I want to be really quick on this. That's our favorite feature. And if you join our Facebook group here, which I'll put a link in the chat box right now to join the Facebook group, this is where we have about 50 of the top data-driven health professionals in the entire world a part of this community. This is where we do our monthly masterminds, and we've got some really great community engagement and networking happening with all of our members. So anyways, this is where our Founders Club members can network and connect with each other. So if you want to go ahead and click the link in the chat box and go ahead and add yourself to this group, we'd love to have you be involved and go ahead and introduce yourself in the group. So that is the Facebook group. And the last thing I want to share is the pro monitoring. Everything I went over, the individual client has access to. Now I'm going to share where and how you can track your client's data on your end. So we have, as a pro account, which I'll put a link in the chat box in a second to create a trial account. Why don't I just do that right now? I'm going to log out and go here. So this link right here, I'm going to put in the chat box, and you can go ahead and request your free trial if you haven't already. So, so I just put it in the chat box. So follow that link to request your free trial, and I'll go ahead and back and log in and show you how you can invite new clients and manage them. So after you create your free trial, I'm going to accept you on my end. I mentioned we're very intentional about who we bring into this community right now. So we'll have to set up a one-on-one call after you're accepted and make sure you're a good fit and just see how it could work for you. But once you get in there, you're going to have your own personal sandbox of data that you can use yourself personally. And then you'll have your pro account. To get to your pro account, you just select pro account up here. That takes you to this dashboard here. This is where you invite new clients and manage them. To invite a new client, it's really simple. You click the invite new client button, you put their email in, and they get an invitation. They join the platform. They're not hit with any paywall. Your monthly membership with us covers the cost of your clients. Okay, so they're not hit with any paywall. We honestly suggest you position this as a value add and a bonus in your offerings. And that comes to my point that I'll get to in a second around how you can use this to sell and bring on more clients and patients into your practice. So I'm going to cover that before the end of this call, so hold me to that. So that's how you invite new clients. Once they accept it, they'll go in the active category. And this here, my friends, is where you're going to manage your clients' data. So we call this the Smart Rows feature. The Smart Rows feature allows you to choose what data you want to see on all of your clients all at the same time without leaving this area. This is the remote monitoring capability. So you can choose maybe time zone. Maybe I want to take time zone off. You can see when their last login was, activity. So if I want to add steps, you just click the box, body composition, weight or body fat, blood pressure, resting heart rate, blood oxygen, metabolism, blood glucose or ketones, rest and recovery data. Let's say I want to take off AM readiness and add in temperature deviation, and then body temperature. So you can customize as many data points as you want to see on all of your clients at the same time. So here's one client of mine. He had 2.5 hours of deep sleep last night, which is pretty good for him because I know that because no, that's myself. So actually all of these clients, you can actually click a down arrow here and it'll show you your client's most recent data from that day relative to their individual baseline. So it's all n equals 1 without leaving this page. So it looks like deep sleep, he got an hour and 1.6 hours today, and his weekly average is 1.2 hours, and his monthly average is 1.3. So he's trending up. Today was a great day for him. Total time of sleep was higher as well, and his steps was a little lower. So that's kind of a cool way to dive deeper into data without leaving the section. So let's say you wanted to track blood glucose or heart rate variability or blood pressure. And soon we're going to have alerts and notifications set up. So if someone's out of range, you and your clients are going to get a notification if blood glucose was elevated, if resting heart rate was elevated, if blood pressure was elevated or outside of the range. You will get an alert and notification. So that's a cool feature. The last thing to share with you, if you want to dive deeper, to run reports on your clients, you just come over here and click View. This will take you to their dashboard. So this pink toolbar at the top indicates that you are in your client's dashboard. So if I wanted to run a report on my client, I go to his report section. Okay, and then I'd run a report. If I want to add lab results to my client section, I go to his lab results section or his medical records section. And then this is where I can store PDFs. You can also use this medical records section as like a little learning management system, an LMS, to deliver content and programming. That's one thing I forgot to mention earlier. So that's how that works to go deeper in your client's profile. We've got a private Facebook group that your clients can join as well, and a knowledge base for all of your clients. Lots of resources. Just to go back to the Pro Portal, you click cancel at the top, takes you back to the Pro Portal, and that rounds out an overview of the platform and how you can go from spreadsheet hell to data analytics heaven, my friends. And so I'll take any questions here now. Otherwise, I put the chat box, I put the link in the chat box. It looks like Angela, Denise, Marek, and Kevin, if you guys are interested in discussing further, go ahead and please request a trial and we can set up a call. And the last thing to go over is just, what does membership include? So this is the base level membership for the Founders Club. The Founders Club total value is about $1,000 a month. You were to buy all of these things individually. Number one, base level membership gets you 50 clients, which is a $450 value. If they were to join on their own, it'd be $9 a month. But they get it for $0. You cover the cost at a much lower rate than $9 per client. Access to all your clients' data, the secure file storage, the analyzer, and then the customized dashboard. This spreadsheet is where we are going to customize and build your default dashboard for your clients to stay focused on tracking what you want them to track. And last but not least, the monthly mastermind with Dr. Lemansky and myself. So total value, $1,000 a month, but for joining with us early, the early adopter rate, only for the first 100 health professionals, is $99 a month. So $99 a month, that gets you, that's up to 50 clients, so about $2 per month per client. And again, this is only for the first 100. We have no long-term contracts. But once we get to 100, this pricing and this membership will be gone. So that is the opportunity to get involved with us. And of course, the bonus onboarding call to review your goals and customize your portal, and our private Facebook group for Founders Club members only. Those are included at a couple bonuses, no extra costs. It's just $99 a month. So your next steps are to start your free trial, which I put that link in the chat box. Schedule your personal call with myself. We can see if you're a fit. And last but not least, I want to give you that final tip. So how you can use our platform to sell more products and services and bring on more patients. So what you can do is, for your clients or not potential clients that you promote this dashboard with, you can have your default dashboard be more advanced. For instance, you can choose 10 or 15 metrics for your clients to track for all of your actual paying clients. But let's say you wanted to use our platform to bring in new business and attract new customers. You can offer them a free trial of Heads Up with you monitoring them for an abbreviated version, meaning you can go into their own profile. Just like I did earlier, you go to your pro account. Once they accept the invitation, they can have an example, their dashboard. So if I go to my client's dashboard here, you go to their dashboard and customize it and take away a lot of the tiles and only give them a couple of the tiles. You can use Heads Up, this software, the free trial version for your clients, to bring them into the fold of your offerings. Get them used to you working with them, remotely monitoring their data, and maybe offering them a free consult where you then tell them about your packages, depending on your business model, if you're cash pay or insurance based, and what exactly you're offering. We want you to be able to use our platform as a powerful tool to make more sales and bring in more clients to your practice. So that is the last and final tip, and we'll go into more details on a one-on-one call with you in terms of how you can use this to better promote and position your products and offerings as a bonus, as a value add. We've nailed the user experience. So this is a really powerful patient engagement platform, and that can help bring in and keep your clients happy, your patients happy with you. So that's an overview of today's Ditch the Spreadsheets, how to organize and centralize all of your clients' data and optimize outcomes with ease. And we are leading the data-driven healthcare revolution, my friends. I look forward to hearing from you. I'll take some final questions if you have them. Otherwise, I'll put the link to actually schedule a one-on-one with me. This is the link you're going to go to schedule a one-on-one. And then I already put the link in the chat box for the free trial. But it's been a pleasure to have you on live with us. Thanks, Denise. You're very welcome. You need one discussion before the free trial. Sounds great. I'll set up a call with your office manager. And Marek, would love to hear from you as well, and everyone else that was on this call. Ryan, John, Kevin, we've had great engagement today. Thank you guys for being on. And again, we'll have this recording out as well. So if you're watching the recording, you can, just like everyone else, schedule a private call with me, request your free demo, and we shall stay in touch and support you and see how we can best help build your practice into a data analytics machine. All right. John, any last parting words to add?
Sounds good. Just sign up. It's worth it. That's my sales pitch.
Exactly. Yeah, it's pretty simple. Yeah.
It's pretty simple. It's pretty straightforward. There's nothing else like it. It'll streamline your business. It'll make your life easier. It'll make your significant other happier because you're happier.
There you go. There's the fringe benefits. It makes your household happier overall. Yeah.
Yeah.
Awesome. Cool. Well, thanks for being on with us, John, and for everyone joining us today. We'll send out this recording and we'll get one-on-one calls set up with you all. And we're excited to help you ditch the spreadsheets and take your data analytics practice to the next level.
Thanks, everybody.
We'll talk soon.